This episode of the Midwife Crisis deals with the very difficult topic of infant and pregnancy loss and may be challenging for some listeners. Discretion is advised.
Hello, my name is Kate.
Hello, and I'm Piyar, and this is the Midwife Crisis because it's not just you. Today we wanted to change gears a bit and talk about something that is a challenging topic, yet one that many women and families express that they wish we talked about more, and that is pregnancy and infant loss.
We are so thankful today to be joined by one of my best friends, the incredible Meghan Constantino, certified nurse midwife. Meghan's not only an accomplished midwife, awesome mama, and a really good friend, but she's also the former program director of Hope After Loss. Welcome, Meghan.
She's my friend too.
Thanks, guys. It's good to be here.
Meghan, do you want to tell us a little bit about yourself? You could tell us about your work or what kind of midwife you are.
So I have been a midwife now for, 13 years. I started off as a midwife in a clinic setting and then moved to private practice where I have worked with both of you guys and then have since for the past few years moved to another clinic setting. Up until about 5 years ago, I did full scope midwifery where I did, well woman exams, I did prenatal visits, and I did birth. And about 5 years ago, I stopped doing birth, but maintained the rest of my practice. In my current job, I don't step foot in a hospital for the most part and just take care of women in the office.
So something else that's kind of special about Meghan is that she is my midwife grandma. So she kind of trains the person who trained me, and she also trained me up until she had her son. So anyway, we have a special relationship.
Yeah.
So a couple weekends ago, Meghan and myself and another one of our friends who also works in women's health were all together at brunch and talking and laughing and, just kind of everywhere we go, as Piyar and I have said, we talk about what we do. So the waitress came over and said, "Oh, what do you guys do?" And we told her that Meghan and I were midwives and our friend is an OBGYN. And she got so excited. She's like, "Oh my gosh, that's so much happiness and so much life every day. That must be such an incredible job." And I think we all kind of smiled politely at her and we said, yeah, it really is most of the time absolutely wonderful, but it isn't always. And she was really struck by that. She really, I think, had a hard time wrapping her head around the idea that some women and families don't get to take their babies home or lose them long after they have babies. She's blessed, I think, in that regard. But I think that's one of the reasons why it's so important that we talk about this today.
I didn't have the good fortune to be at that soiree, that little brunch.
It actually was really weird. It was like eating at a buffet at someone's baby shower. So we're probably not going to go back there.
There might have been paper
anything.
plates.
There was paper plates.
Oh, okay. Well, I'm happy then. I guess I wasn't there.
The company was great, though.
But they did tell me about it. And so today we thought we would have a conversation about this challenging topic of pregnancy and infant loss because it's something that women do want us to talk about. And what we'd like to do is share our own experiences and some factual information about loss and reflect on how we can support each other and be better at being inclusive and supportive as providers, women, and as friends. So we thought we might start by sharing our lost stories. And since I'm talking, I think I'll go first, if you guys don't mind, if that's okay with you. And my story is pretty brief. I was a grad student, and when you are a grad student, you're under a lot of stress, and things happen, like you miss your period, and you don't realize what's going on, and you don't really care what's going on because you are busy. And also, I had an IUD in place, and I thought I'm safe, and I'm probably missing my period because I am under a lot of stress. So I had, on the day that this occurred, I started to have a lot of pain, and I was studying for a statistics exam. You guys remember statistics, right?
I still have nightmares about statistics.
I was a mathlete, so it wasn't so terrible. I liked it.
Show off.
Yeah, no.
Yeah, it gives PTSD to most. So anyways, I was really, determined to do really well on this exam, and being competitive as sometimes I can be. And so I was working on it, but the pain just increased as the day progressed. And my friends are sort of, what's going on? What's wrong with you? And I said, I don't know. I'm just having a lot of bad. This isn't good. And they said, well, the exam it's coming up close. It's like in an hour or two. What are you going to do? And I said, I can't. I have to do the exam. And it got so severe, I went into the restroom and sat on the toilet and just basically expelled a fetus. That's what happened, because the pain was horrible, and plop, and I stood up. I got great relief, and I stood up and looked back in the toilet, and I said, "Oh my goodness, what should I do?" And I was torn between wanting to scoop it out and thinking, okay, I'm just gonna send it on its way. It's thinking about it, I've thought about it many times since then, but just kind of thinking about it right now, it's very clear. It's like it happened a week or two ago, because I still see it very, very vividly. And so I flushed and I went back, and I was just feeling so much better, and it was clear what had gone on. And I went back, and they said, what's happening? And I said, I feel much better. And I said, I just miscarried. And they said, what? We need to take you to the infirmary and see what's happening. I said, no, I got to take the exam. We went to take the exam. Oddly enough, I aced the exam. It was the only stats exam I've ever aced. And then I went to the infirmary, and they did a pregnancy test. And of course it was positive, because you still have pregnancy hormones and they show up positive in your system. And they said, we have to take that IUD out because it had overstayed its time. It was supposed to have been removed, and I had left it in because I just said, why not? And the important part of this story is some of my family don't even know that I was pregnant. I never told my own mom, sorry, Mom, that I was pregnant. And part of the issue there was I felt like I didn't need to be pregnant. I had children already, and I was in school, and I needed to finish school, and I felt like, okay, this is the universe taking care of things for me. And so I didn't even allow myself to process that the loss. It was sort of like, okay, things are taken care of, and I don't have to process the loss. And also, I come from a culture of I'm supposed to be strong, and even if you have a loss, you're supposed to just soldier through and just keep going. And the truth is, this isn't about being Black or being white or being Latina or being anything and from any ethnic group. It's about being human. Mm-hmm. I'm a human, and that was a baby, and it went away. Whether I needed to have a baby or not, didn't need to have a baby, and I have feelings, and so, and I didn't get to process that.
Right.
And so I think I'm going to end my story there and let these guys, because we can tie it all together at the end. But that's something that everyone deserves to do, is to sort of process what happened to them. And I'll explain a little bit later why I didn't share with everyone the whole experience. And it has to do with the potential reactions and negative reactions.
Well, thank you for sharing with us.
Thank you, Pam.
We thought maybe Meghan would want to go next.
My story's a bit long,
That's
but
okay.
I'll try to make it appropriate.
Tell us your story.
Well, I usually start, I tell my story a lot because I find that it's very helpful. And I often start off by telling people that I was about 28 weeks pregnant with my firstborn when the doctors told me that my baby would most likely die. It had been a very easy physical pregnancy, but had been hard emotionally from the get-go. When I went for my first dating ultrasound, they saw an empty sac, and so we thought I was having a form of a miscarriage, but weren't quite sure, and we scheduled an ultrasound a week later, but I spent that week feeling what I thought was awful. Like I thought I was miscarrying. And a week later, when I saw the ultrasound with a little heartbeat, I cried. I was so excited that that I was not miscarrying, but then I tiptoed through the whole first trimester, because everyone always thinks we just got to get through that first trimester. And I thought I knew what it felt like to miscarry. And I didn't ever want to go back to those feelings, even though I hadn't. And so as we were approaching the end of the first trimester, I told my family cautiously, saying, we're pregnant, and but don't tell anyone yet. We have this ultrasound coming up. Once we get through that, then you feel free to share the news. And come that ultrasound, the sonographer had to pull the doctor in, and they told us that something was wrong. This is an ultrasound that I elected to have. It's a genetic ultrasound, basically assessing the risk of chromosomal abnormalities like Down syndrome and trisomies. And they're measuring the thickness of the baby's neck. And based on the thickness of my baby's neck, it was clear that there was a high chance that there was something wrong with my baby. They laid out a table and of what the possibilities could be, which included Down syndrome or another trisomy, some of which were livable and some of which were not, a major birth defect, a healthy baby but stillbirth. And when you lay out all the numbers, the chance of something being wrong was about 1 in 3. My husband is an engineer, and so he looked at that number and was like, great, there's a 66% chance that everything is fine. And me being a midwife, having dealt with these kind of numbers on these kind of tests before, this was a very high number. So so from there, we elected to do invasive testing. I had a CVS, which is a chorionic villi sampling, which involves a needle in my belly that goes through the uterus and takes a little sample of the placental tissue, and they can test that for chromosomes and more. The testing has become very advanced. And it's as accurate as you're going to get. Nothing's 100%, but as accurate as you're going to get prior to birth. And I spent a painful weekend trying to stay off the internet, but unsuccessfully, to figure out what was wrong. And when the phone call came in the following Monday from my midwife, she said to me, "Megan, it's Down syndrome." And at that point in time, I was relieved. Of all the possibilities, Down syndrome for me was livable. And the other ones might not have been. And I had said to my husband even before we did this test, because I chose to do this test for me for information, and I said, if our baby has Down syndrome, I think our family is in a place where we could raise a child with special needs. And so when we got that news, I welcomed it as good news. And so then we just continued on to the pregnancy slowly, because my next question to the midwife was, and the genetic counselor actually was, what's the risk of loss with a baby with Down syndrome? And they said it was 20% in the second trimester and 12% in the third. So that whole getting through the first trimester and taking a deep breath and feeling relief was gone. So I just continued to tiptoe. We got to 18 weeks and then 22 weeks, where we had 2 big ultrasounds looking at the baby's anatomy. And we found out that my baby's only issue was club feet, which for me was not major at all. And it didn't appear that my baby had any heart defects, which is pretty common in children with Down syndrome, about 50% of the time. So I could finally breathe. I could actually envision after 22 weeks that, okay, I'm going to potentially go home with a baby with Down syndrome. I started building a baby registry. My husband and I attended the Connecticut Down Syndrome Congress annual convention, where we learned all about Down syndrome, went to lectures, met a pediatrician who specializes in it, and then met some other new or expectant parents with babies of Down syndrome. It was great. And then we went to the next follow-up ultrasound, and I'm sitting there looking pretty happy at this ultrasound because I wasn't expecting anything to happen. I was just worried about the growth because babies with Down syndrome can be small, and the growth was good. Everything was looking good until the sonographer said that there was very low fluid. When it comes, I was 27 weeks, and when it comes to low fluid at that point, it can be pretty significant. Babies need fluid for their lungs to develop, and when there's low fluid at that point in time, two things are at risk. Well, more than that, it usually means that there's something wrong with the kidneys, provided that you haven't broken your water and the placenta is working, which neither were the case for me. And that's what they figured out, is that my baby's kidneys weren't working. And then once there's low fluid, the lungs pretty much stopped developing. And so whenever the fluid became low, sometime for me between 22 weeks and 27 weeks, the fluid, the lungs would stop developing at that point. And a baby with 22 week size lungs is potentially not viable. That baby might not live, and a baby with 27 week lungs might, though it still would be difficult. Plus dealing with a kidney issue, plus dealing any other potential issues going along with Down syndrome. After a whirlwind weekend in the hospital just to figure out what was going on, a meeting with specialists, my husband and I opted to leave the hospital, go home, and let our baby do what our baby was going to do. We were also at risk for stillbirth because when there's no fluid, there's nothing there to cushion the cord, and the baby could sit on the cord and stop the oxygen flow and increase the risk of stillbirth. So we just took it day by day. We'd see our midwives weekly, check in about heart rates, make sure the baby was still alive. I took some time off of work because it was very hard for me to be a midwife and see pregnant women carrying a baby that they were carrying babies that they might be happy to be carrying or not happy to be carrying. They might be complaining about things that are significant, complaining about things that to me felt like they weren't significant compared to my issues. So I took some time off of work, but it was hard to be off work. Being a midwife is also a lifestyle. It's our identity. So I went back and just continued on. At 34 weeks, I went into the hospital for continuous monitoring because at that point in time, we were ready to do whatever intervention we needed for our baby. And I stayed pregnant for a couple more weeks. And on Valentine's Day of 2014, at 36 weeks, I went into labor. It was earlier than I thought. We were planning an induction somewhere between 37 and 39 weeks. I wanted to stay pregnant as long as I could, but babies sometimes have other plans. And after a relatively short labor, my daughter Mabel was born. And she was quickly whisked away to the NICU, where she went from oxygen to CPAP to a ventilator. We had met with the NICU specialist ahead of time and said the one thing we didn't want is to be on a treatment train. Like if she can live, would like to help her, but if things aren't going to get better, we want to know, because I just did not want her to die in that little NICU table by herself. If she was going to die, I wanted it to be in our arms, and as comfortably as possible. I didn't want tubes or anything in her if we could prevent it. And so we spent some time with her afterwards, and she the doctors could tell right away that her lungs weren't working. One had a hole in it from the ventilator, and the other one just, you couldn't even really tell if it was well formed. And she couldn't hold up her oxygen saturation. So we knew we just had time with her. And we asked the doctors to tell us when the time was getting close so that we could take off the tubes. So we had about 6.5 hours with her, and had some family visit, had all my midwives and my maternal fetal medicine doctor visit, some friends visit, had a blessing, and then took out the tubes, and my daughter died about 20 minutes later in my arms with my husband and family by my side. And we buried her a few days later. And so that's my longest story of loss. I did actually have a very early miscarriage later on, between my third pregnancy. So Mabel was my first pregnancy. I then went on to have a living son. And then when I was about to try for my second living child, I had a very early miscarriage. I was very surprised. I had been trying since the birth of my older son, and I was about to start fertility treatments and got a positive pregnancy test. And a week later, started bleeding.
Mm-hmm. Thank you for sharing.
Thank you.
I know that No matter how many times you tell a story or your history like that, and it's painful, it's not an easy story to tell. So we
It's not.
appreciate it.
It gets easier, and it's nice to tell the story. It's such a huge part of me.
As your friend, I always like to talk about Mabel, and I always like to hear you talk about Mabel because I can see like the happiness. I can see her emanating out of you, and it's really beautiful.
Thank
So,
you. Yeah.
Thank you for sharing.
Thank you.
So I will go ahead and share my loss story. And, I find it kind of interesting. And I wanted Meghan purposely to go before I went because for a long time, also did not share really my loss story. And the only reason why I felt like I could start feeling okay about it and sharing it was actually because of Meghan. Because Meghan was my midwife, and she talked to me. So I've actually talked about this before as well, so I'm going to sort of go based on that. But for a long time after my miscarriage, I felt really ashamed to feel sad. When you work in obstetrics and you see people having different scenarios happen, and you see people who lose their babies at all different types of gestations, even having one of my best friends, only have 6 hours with her full-term baby that she carried to term. I just felt really guilty and ashamed that I felt so sad about my loss. It was really early. I thought I was like maybe 8 weeks along or so at my first ultrasound, and they saw what they thought was an empty sac, and they thought maybe my dating was wrong. And I spent so much time on all these message boards about people with similar to Meghan's story, where people had what's called a blighted ovum or an empty sac, and then they wait the week, and the next ultrasound, there's their baby. And I remember my husband being like, "Yeah, that's going to be us. This is it. This is this baby," and it wasn't. That baby, was never there. And so not long after I had lost that baby, I needed what's called the D&C. It's a surgical sort of assistance to clean everything out of the uterus after you have an early miscarriage. And I remember going to my doctor, and it was right around my birthday, and saying, "You know what? I have my birthday off, so let's just do it on my birthday." And she said,
"Whoa."
Yeah, she said, "I will not do this on your birthday. You will take one day off of work." And I said, "No, I don't want to bother anyone." And she said, "No, absolutely not. We're not doing it on your birthday." And I'm thankful for her telling me that to this day, because
Hallelujah.
yeah, I still got a different day. But after this, I was grieving a lot. I woke up from anesthesia from that procedure crying and feeling a real loss every time I'd be away from my husband. I felt this emptiness when he left me. And this baby would have been due in January, around my mom's birthday. And the January birth flower is called a snowdrop. And so I thought, I'm going to get a snowdrop tattoo. If anyone knows me, they know I'm covered in tattoos, and that's how I cope with a lot of my, feelings. So I'd mentioned it to a friend, and she made fun of me. She laughed and was like, "What, for that blighted ovum? You weren't even pregnant, like, really?" And it totally shut me down. And I heard that, and I said, "She's right. What is wrong with me? Like, I have so much to look forward to. I have, so many wonderful things in my life." And I just totally shut it down, and I pushed it away until I had already had my oldest son. I was training to become a midwife, and I got unexpectedly pregnant with my second son. I was having a really anxious day. I remember I was in the office, and for some reason, I was just so worried about this baby. I was still early. I was worried about, that I hadn't really cared for this pregnancy. And for whatever reason, this day I was just really bothered. And Meghan could tell. I was training with Meghan, and she was like, what's going on? She was also actually very pregnant at this time. So two pregnant ladies, and I'm getting all teary. And I said, I'm worried. And I kind of confided in her what had happened and how I never really kept thinking about or processing my loss, but that it continued to sort of make me worried. And she acknowledged my loss, and she acknowledged my fears, and she acknowledged my feelings. And just like what I've learned to do for my patients, she reassured me. She, made space for my worry. She said, let's go listen to this baby. Let's go make sure everything's okay. And it was. And she that day gave me my permission to grieve. And I think that was when I really kind of processed it. So I'm really, really, really thankful to her. And I like to talk about that baby that would have been there. It was here for a brief moment. It would be 6 years old now, turning 7. Actually, 7 years old this year. And it was the day that we had our positive pregnancy test for that baby was the same day that my husband's grandmother passed away. And
Wow.
it was due on my mom's birthday. So I always remembered thinking,
Lots of connections.
yeah. And I always wanted 3 babies. I have 2 now. And I always say that was kind of my third. And I always felt like it might've been a girl because of all those sort of feminine, connections. I always say it was my blighted ovum and my broken heart. That was that baby.
Wow.
And that's my loss.
These are our stories are very poignant. I'd like us to sort of have a conversation and pull them together about how they changed us as women, how they changed us as providers. What are the hardest things that we had to listen to people say? What were the good things that people said that were helpful to us? Because these are the things that that other women need, basically, that they're not hearing, and that they're saying no one talks. It's like a secret. And so I'd like for us to kind of just converse about it a little bit.
Okay.
What kind of support would have been helpful or was helpful, and how can we better support women, trans men, gay men, everybody through like be inclusive in supporting folks through the loss. Who wants to start?
Well, I feel like I already pretty much shared. I was lucky enough that I had that loss, and that it was before I was a midwife. And I really feel like as a midwife now, when I have to go through these things with patients, I really allow them to grieve. And I remember before this happened to me, feeling like, ugh, it was only 5 weeks. Like, really, you're gonna be sad about this? You were barely pregnant, and you hear that. You hear that term a lot. That person's barely pregnant. Why are they so upset?
There's no such thing as barely pregnant.
Right, exactly.
And so that really, sometimes we get a little jaded in our business, and we say things like, she's barely pregnant. Oh my God, it's 5 weeks. And it's like eye rolling and all. But it means different things to different women, different people, if you're a trans man who's pregnant. And so, that's something that requires a little bit of learning and open-mindedness on the parts of some providers and some women, is to stop and just stop the shaming. Just accept it for whatever it is. If someone is speaking to you about their blighted ovum or their 5-week pregnancy or whatever their loss was, you need to let's meet each other where we are.
Yep.
I think. I don't know. What do you guys think?
Yeah. What do you think, Megan? Because I think you have a broader spectrum of.
Yeah. I've had not only the chance to help women through loss as their provider, both before my losses and after, but also to be a peer in the loss community, doing a lot of work with a local resource, Hope After Loss. So hearing people's stories, and it's really interesting, even among people who've had loss, how difficult it can be when people have different losses. And I like what Piyar said about meeting each other where they are, and that's something that we've really stressed in the loss community. So when people come in, people have had early losses, and they hear stories of people who have later losses, sometimes they feel like they don't belong. And what I think groups help them realize is, when you have an early loss, yes, you might not have been pregnant as long, but you lose other things. You lose a chance to potentially announce your pregnancy, your chance to look pregnant, to have a baby shower. You lose other things. There's all these other secondary losses versus someone who loses later might have enjoyed their pregnancy, but then had the loss, had to have a different kind of delivery than someone who had an early loss. So finding that common ground is important. I think my loss myself has changed me hugely. I think back to all those times when I was helping people through loss prior to my own, and all the times where I misspoke. I didn't know. And so I think it's so important that we're speaking up about things that are hurtful, that we don't know. The intentions are good, but the feelings are bad.
Can you give us some examples?
Yeah, I remember being with a woman who had an early loss. It was the first trimester, I think maybe 8 weeks pregnant. And she looked at me and she said, "What am I going to tell my 6-year-old?" And in my head, I just kept thinking, I can't believe she told her 6-year-old. Why are you telling anyone you're pregnant? like at this point in time. And after my loss, now I understand, I kind of think every pregnancy should be celebrated, especially, if it's a wanted pregnancy and you're ready for it. Like, this was clearly a very wanted pregnancy for this woman. Of course she was celebrating it, and let her have this in some ways blessed innocence where things are supposed to work out. So I'm upset at myself for even having those thoughts. I didn't have any good answers for her. I just before I got pregnant with Mabel, I had a very dear patient who I helped. She hadn't had a loss history, and she just had a postpartum issue, and in her second pregnancy, she lost her baby to stillbirth a few days after her due date. And her experience, followed by another miscarriage, after that, I hold this experience with me, and thinking about how I tried to help her through this when she had her miscarriage after loss. And I remember saying things like, maybe your baby needed someone with them, and that's why you lost your second baby, which is not necessarily helpful. I'm trying to fix the problem. And that's one thing I like to share with people. When someone has a loss, you can't fix it.
Right.
You can just be with them.
Right.
So don't try and fix it. Don't try to make it better. There's nothing you can say that's going to make it better. What makes it better is allowing people to feel their feelings, share their stories, and just being with them.
That's huge. That's huge.
Right. I feel like it changed me as a provider, because when we're looking at how many times a woman has been pregnant and we see that column of losses, and especially if they're early losses, we just kind of gloss right over it. I have tended to do that. And so when I'm taking a history, I let her be the guide in terms of what kind of standing it has for her and the importance that it has for her. There, in the immediate time after I had that miscarriage, I didn't even say that I had miscarried. Like, I put it away and people would say, "Well, how many times have you been pregnant?" And I said, "Well, I have this many kids and this is how many times I've been pregnant." And that later on, I felt like that was so unfair. Yeah. When I became pregnant again, almost immediately, not on purpose again, I thought, this isn't right. As the pregnancy progressed, I was like, you have to count that. You need to be telling people, even your midwife, like, you have to say that's what happened. And I say even my midwife, because I was a grad student, I was cared for by the university service. But because I was becoming a midwife, my favorite midwives agreed to care for me and catch my babies, even though I wasn't being seen by that practice. So that's why I said you have to tell your midwives, and people would say, well, weren't her midwives taking care of her? Weren't they the ones who did the pregnancy test? No, they weren't the ones who did the pregnancy test to say, oh, you're pregnant, we have to take this IUD out. It was like two different services, two different practices. And so initially, no, I didn't even, it wasn't because I was ashamed. I was married. There was no shame. It was just sort of like, you didn't need to be pregnant. It was like the practical me. And no one's going to what are they going to do? You can't celebrate, you can't mourn, and you can't just move on.
Right.
And so it was, but that's part of my story.
Yep.
That's part of my history. And so now I sort of deal with patients the same way. Like, that's part of your story. You don't have to poo-poo it away.
Yep.
And even in those situations where women have voluntarily decided that they would interrupt a pregnancy, I'm like, that is your decision.
Right.
You have a right. You had a right to make that decision, and I am not judging you.
Right.
So you don't come to me with shame of all people, because I'm here to care for you, and I take all of your story with you. You bring it all with you. And so I feel like it made me better in that way.
Yeah.
And they feel more comfortable. Sort of when we're sorting out what that column means. Was it spontaneous, or was it, something you did voluntarily? I encourage them. I said, you can tell it all. It's not, you don't have to come with shame.
Right.
And so I think that they appreciate that.
Absolutely.
People didn't say, there wasn't anything hard for people to say because I kept it a secret. And they didn't say anything other than, let's go to the infirmary. Well, to do what? It's not, they can't fix it. And I didn't know. Unfortunately, when I thought back, I had missed a few periods. And so it was quite advanced. And that was, the good news. They said, well, are you bleeding heavily? Like, we're all gonna play midwife now.
Right.
Like professional midwife, and we're all students. And no, I'm not bleeding heavily. I just feel so much better. Let's just go take the test. It'll be fine. I'm going to go right after. It'll be fine. And then the next day I went to school and they said, how are you? And I said, I'm fine. Everybody's fine. It's all fine.
Yeah.
Fine. And so I think, they were all supportive, and that was helpful for me, but the situation wasn't a thing per se. And so I'm looking to you folks to teach me how to better support, the little bit of experience that I had personally. Yes, I learned something from that, but I'm learning from you guys, how to better support. And I think that's beautiful what Meghan was able to do for you, Kayte, in your situation, and it sort of helped you grow and stuff too. And
it's uncomfortable, right, to talk to someone about their loss and about their pain. But I think from my experience, and I don't know, Meghan can probably chime in better on this, but I think sometimes, as you said, it's nice to be able to talk about it. And if the person's not trying to fix it and is just listening with an open ear, and we have to allow people to do that. You're telling your story, Piyar, and I'm remembering, I've shared before that my partner and I were trying for a long time to get pregnant. And so when we had this loss, it was sort of compounded. It was, almost 18 months of trying, and then, oh my gosh, it's finally going to happen right before I went to reproductive endocrinology, similar to, Meghan's second loss. And then I had this miscarriage, and then, and I didn't tell a lot of people because I'd been shut down by someone I cared about. And so I remember that Christmas, my mother-in-law said something like, oh, I was really hoping for a baby this Christmas. And it hurt me so deeply. It was unfair to her that it hurt me because she didn't know.
Right.
I didn't share anything with her
Right.
about us trying to conceive, about all the struggles we'd been having, about how it was hard in our relationship, and how absolutely devastatingly sad I was. I didn't share any of that, but hearing those words was very hard. And I feel bad that I didn't tell her.
Well, I think, Kayte, that you bring up a very good point where we don't know everyone's story, which applies to so many different parts of life. But when it comes to pregnancy story, it's huge. When I was in the depths of my loss, I remember I was in IKEA, and here I was walking around, and nobody knew that I just had a baby. Like, I really just had a baby. And I saw this woman I knew professionally there with a baby in a carrier on her chest and another like toddler by the hand. And I just shut down. My heart sank. It was anger, jealousy, grief, all mixed in, thinking like there's someone I know. There's another person with like this happy little life. Good for her. Here I am. I have no baby to show for it. And just was yearning for something different, a different outcome for me. And a few months later, I saw this same person at a remembrance walk where she was remembering her firstborn, who was stillborn. And I didn't know that. And it was such an eye-opening experience for me. So, which almost I wish to have a little sooner, because part of the grief cycle for me, well, for a lot of people, is anger. And for me, it manifested as jealousy. And that was helpful to know that people are walking around with all these silent losses. I should have known that. I was walking around with one, but there she was. Like, not everyone who has a happy life. People who see me now, I feel like my life is very full. It's not complete, but it's full. And they might not know all that I went through to get here. I was also thinking about, the words that we use, and it is so easy to try and use words to fill that negative space, that space where it's so uncomfortable. And even I have been through loss. I have professionally helped people through loss in different ways, and I still don't always know what to say. I recently was with someone who lost their baby full term and sat with her, and it still felt uncomfortable because loss is always uncomfortable. I, of all people, could have said things to her. We had very similar stories in many ways, and I still didn't know what to say. So, number one, it's okay not to know what to say. And you can say that. You can say, I'm so sorry, I don't know what to say, rather than trying to fill that space with other words that, other platitudes that come across good intention but can be hurtful, such as everything happens for a reason.
That's the absolute worst one.
It is.
Who came up with that?
I don't know.
I want to stab them.
I don't know. But I heard it from the beginning when I was pregnant with Mabel, when she had Down syndrome. So I had been hearing that, and that made me mad then too. And I was expecting a living baby at that time. Like, this is only what are the phrases? Like, God gives only what someone can handle. You're so strong. I could never do what you're doing. And then another one that's one of my top favorites is at least. And I had a very good friend who very well-intentioned said, at least you got to hold her. My grandmother lost a baby and she never got to see her, and blah blah blah. And I felt nothing when he said that. I actually felt like less than nothing. I felt a little angry. Like, at least I should be happy that I got to hold my dying baby, which is not what he meant. What he meant to say was, I am so glad, I'm so grateful you got to hold her. And that's just a little word that I try to incorporate into my talking when I'm talking to people through loss. And it's also helped me in my own loss, thinking about things I am grateful for. I am so grateful that I got to hold her. And I'm grateful that I got to hold her alive, which is this really weird thing to be grateful for, because in the loss community and in real life, stillbirth is something that none of us have experienced, but that is surprisingly common compared to a lot of losses. My type of loss is not that common, but a term stillbirth is much more common than mine, and that is something we don't talk about. But I can show a picture of my baby on the vent. I can show a picture because in a way that's a little bit more socially acceptable. Even, we hear a lot in the news about things like SIDS, which has a good heart-tugging message to it, because those are babies that were living and people interacted with. But when you look about the numbers, the stats, in the U.S., about 3,500 babies die from SIDS in a year. 24,000 babies are stillborn. Not saying one is worse, like more valuable than the other, but why are we not talking about stillbirth? Like, that's a huge loss as well.
I mean, I think a big piece of it comes from trying to preserve some innocence. And I think, that waitress at our funky brunch was, she was a really good example of that. She was so blissfully unaware. And, further in, she sort of shared, and I'm a twin. And, all of us sort of like cringed, because in the birth worlds, we know like twins can be danger. They can be pains in the buns. They can come early. They can, only one of them can pass away. I mean, they can have all different types of scenarios. And, and just to hear how absolutely unaware she was is, I think it's harder when people go through that loss not knowing. But I also think there's a delicate balance, because being pregnant, as we all know, being pregnant and knowing all the possibilities is also terrifying.
It is terrifying. it is, being pregnant, knowing all the possibilities. I thought it was terrifying, and then I got the possibilities, and it was just as terrifying as I thought it would be. Yeah. It is unreal. And I think being pregnant after loss is a very common thing as well. If we're talking about how many people go through loss, especially if you include miscarriage, at least documented miscarriage, 25% of women have had some sort of pregnancy or infant loss at least. And so we're caring for people, we're sitting next to people who have done this, and a lot of those people go on and become pregnant again. And that's affected my practice. I feel like that in a very huge way. I can make a really concrete difference because when someone has had a loss, and we recognize it, like Piyar, you were saying, what does this mean to you? How are you feeling? I do a lot of, like, how are you feeling about this pregnancy? And a lot of people are nervous. And I say, well, what do you need? How can we help you through this? There's usually nothing I can do to prevent necessarily some sort of loss, but I can help with mental well-being. And, you want more frequent appointments? Sure. I'll come. You can come in every week. Let's just schedule it. Yep. You need that extra ultrasound, which is not a very midwifery thing to do, extra testing. But for certain populations, it is what they need to decrease their cortisol levels and their anxiety levels and have a well-bonded pregnancy. Yeah. So I do it.
Absolutely. I think it's funny because we were sort of talking about how although last week we were talking about natural births and or 2 weeks ago. And although we are both midwives, I think we both really maintain that view that it's a partnership between you and the woman and the family or the trans man, whoever's, carrying this pregnancy, whoever's coping. And we need to, it's a team effort, and so exactly that, meeting you halfway.
Or
where you are.
Meeting you
not halfway. Halfway would be kind of funny.
It's really
just kidding, guys.
It's really we see you and we're going to meet you where you are.
I don't know.
I go all the way.
I don't know if you want to bridge the two worlds, but I had with my daughter, I had an epidural, and my 2 sons, I had no medication, and it's been a very interesting thing as a midwife to have had my first birth be one with an epidural. But and it's taken me a lot of time to sort of think on to process this information, which in some ways is a no-brainer. Like I did not want to deliver this baby. I wanted to keep her inside of me as long as possible, and the epidural gave me a birth that was peaceful with her.
Right.
Having had 2 very not peaceful births afterwards, a lot of screaming very loud, like in all sorts of positions, I was able to have exactly the kind of birth I needed for her, which was lovely.
One of the ways we sort of show folks that it's not just you, is by giving them some information about the stats and how you're not alone. So, Meghan, you want to share you have some info you want to share?
Sure. So some basic stats that I throw around to people to give them an idea of how common any sort of pregnancy or infant loss is include infertility, because that's another kind of loss. That's the loss of the future pregnancy.
Oh, it is. Definitely.
Every cycle is a loss. Anyone who's tried to get pregnant unsuccessfully knows that negative test or the period coming before you had a chance to test is devastating. And up to 10% of women will experience infertility, and even up to 2% could experience recurrent pregnancy loss, which is a combination of infertility and loss. The numbers on miscarriage go from anywhere from 1 in 5 to 1 in 4 women. Honestly, it's probably higher. These are clinically recognized pregnancies. There's people who, AKA Piyar, who don't even know that they were pregnant.
Don't say anything.
Yeah, who have might not realize. And for me, when I had my very early loss, I was tracking, I was trying, and therefore I took a test. And had I been someone else, I probably would have been like, this is a really weird period. I'm having some spotting. And then a week later, I have my real period. Right. But I knew I was pregnant, but some people would have missed that. Yeah. We talked about 24,000 babies are stillborn each year in the United States. 19,000 babies die in the first month of life in the United States. The 3,500 babies die from SIDS each year, and about 24,000 die before their first birthday. So it is pretty common lose a baby in a way. It's hard to sit in a room with women and not have someone there who's experienced loss. They say, what is it, like if there are 23 people in a room, one of them has your same birthday. If there are 23 people in a room, like 6 of them have lost the baby. Like that's a bigger stat.
That's mind blowing, and we don't even talk about it.
Yeah.
And sitting around, like the more you talk, the more you hear. When I was working at Hope After Loss, I was riding in an elevator at an event with other nonprofits, and people were being jovial and asking, and this one couple said, "Oh, what's your nonprofit about?" And we explained, and there was an older couple, and the woman says, "I lost a baby," and it just opens up doors. Once you just say, "We help people with this,"
Yes.
it opens up doors.
It does. You're giving them permission to share, right? We're acknowledging their loss, sharing space with them. It's huge.
Yep.
Do we want to share any info on the LGBTQIA community?
Yeah, absolutely. So,
African American women.
yeah, I think we do tend to get on our own little. Piyar and I have shared sort of the things that are that are interesting to us. And so, for me, identifying as queer and really caring about this specific population of LGBTQIA plus patients, I think that pregnancy loss can be challenging for them because already healthcare is a little bit challenging, right?
For sure.
And this is the most challenging aspect. And so, there's been different studies. There was a study done by Elizabeth Peel called Pregnancy Loss in Lesbian and Bisexual Women, where they were surveyed and, she sort of asked about their experiences. And as Meghan had touched upon, when you have sort of an infertility, which in the case of either 2 women or 2 men, you're starting off with infertility because we haven't mastered yet getting 2 eggs together and making a baby. If we had, I would have a baby already, probably with with one of my friends. Anyway,
we would have a beautiful.
We would have a beautiful, beautiful, sweet milk chocolate baby angel. Anyway. So they are already sort of experiencing this loss. And then it's more of a loss. It's a monetary loss. It's a time loss because when you do reproductive endocrinology, it is, every other morning, your whole cycle, ultrasounds, blood work, testing, medications. So it's money, it's time, it's investment. And so when you have that loss, it's exacerbated. There's all these, sort of heterosexisms where many times I've seen this in my own practice where I've had beautiful, lesbian couples come in and someone will say, "Oh, are you the sister?" And it's like, no, that's her wife. This is their baby. And so we need to work harder, I think, as healthcare providers to allow people to share, and to leave an open-ended question. And who did you bring with you? Oh, this is my wife. And
I go the other way and I say to patients, "Is this your wife?" No, that's my sister.
They're like, this is my twin.
And they'll say, "I have a husband." And I was like, "Okay, well, that's cool too."
Yeah, it's a delicate balance. I do find I refer to everyone's anything as a partner.
Right.
So I'll say, "Does your partner, blah, blah, blah." And sometimes people get very offended by that, especially I find young moms will say, "Well, it's my husband." I'm like, okay, no worries. That's awesome for you. It's still your partner. I hope it's still your partner.
I learned instead of asking, "Are you the wife?" Who did you bring with you today?
Yes, exactly.
Because that's a better question after I was trying to be so super cool and like, "Is this your wife?" "No, it's not my wife." That's what I said there. So,
but you tried. So that's
right.
important.
So who did you bring with you today, and what would you like to be called?
Yeah. I think the third piece that we need to also think about, and it's hard because, again, midwives, we think with women, we think women, also, of course, trans men, but we think about sort of those organs as the piece. But there is this such a larger network of potential loss when you're talking about someone who's LGBTQIA. So that could be, either lesbian women that are conceiving with donor sperm, or sometimes it's a friend, so it may not be just those 2 women. It may also be this friend who is involved who's having a loss. It can be gay men or couples having a child a surrogate, which is someone who carries a baby for them, and a gestational carrier. And so then, maybe that person's going through the loss, plus, this potential parent, whoever they may be. And, I always think of transgender men because you may have, retained your uterus, this organ that is upsetting potentially to you because you want to carry a baby. And then if you have a loss, to then maybe sort of continue to have these ill feelings toward this organ, or sort of feel like it's failed you again.
Yeah, it's betrayed you.
Yeah. And so I think there's a huge view on it that we need to take, and that we need to really try to be inclusive. And, when we're checking in with women, when we're checking in with patients, again, how's everyone doing? We also talk sometimes about the secondary victim. And so, was it going to be her mom's first grandbaby, and she's mourning, or things like that. I mean, I think just being inclusive. We could go crazy with that, and I understand we don't have, we have to do a lot in about 5 minutes with a patient, but just trying to give them some space to share what needs to be shared.
We also had some information regarding the African American community. There was a study done by SUDS, by Sudeshna Mukherjee, regarding risk of miscarriage among Black women, comparison regarding Black women and white women. She did a study, and some colleagues did a study, and the long and short of it basically is that when you when you sort of line everyone up and take out mitigating factors, that there is a greater risk in the Black community when you compare with white women, and that there is a higher risk of miscarriage in the Black community if you look at loss before 10 weeks. And so that's another issue that doesn't really get talked about a lot, that there are, and I'm not sure what the reason is for that. When you make adjustments for age and alcohol use and that kind of thing, it's still that Blacks come out higher risk of loss than whites do. Why that happens, just like a lot of other things, we're not sure why, but it's something to consider. And it's also, we already talked about that cultural element of Blacks kind of negating the loss in the first place if if it wasn't an expected pregnancy, if they weren't economically prepared, if things weren't sort of in the right place at the right time. And so it's sort of like, well, phew, got away with that one. And so I think that that's something else, sort of to consider, that making sure that these women know that they're humans, not with this kind of situation. It's not about being a Black human or a white human, and knowing that you are a human being. And in this case, if it's happening to you more than other women, we just need to pay attention.
Absolutely. Health disparity, racial health disparity is huge, and it's something that we really need to keep in the forefront of our mind, especially if we're going to really be there for all women.
For sure. Is there any other points that you guys think we should bring up?
Anything
today?
You want to talk about, Megan, before we kind of close? Or
I guess sort of my take-home messages when you're dealing with someone with loss, and some of them we've already talked about, but a quick do's and don'ts for both providers and people.
Love that.
That would be helpful.
Yeah, so some of these things came up in what we've talked about. So don't use platitudes, that everything happens for a reason. Do say, I don't know what to say, or I'm so sad that this happened. Don't say at least. Do say, I'm grateful that. Don't try to fix it. Do listen and just be with someone. Don't avoid or abandon someone who's had a loss. Do remember birthdays, attend memorials, donate, do errands, give gifts, visit, distract. Don't forget. Do say their baby's name. Ask about their baby. Light a candle. And don't give up. Some people are not ready to accept help after a loss. So do keep trying. Just let people know that you're available, whether you're the healthcare provider. Sometimes you can just call and leave a message, just calling to check in. And you could do the same as a friend. Yeah, I know you may not be ready to talk, but I'm just calling to check in.
Awesome.
That is awesome.
Thank you so much, and thank you so much
Thank
for
you.
being here.
Yeah,
we are
really
so blessed to
appreciate
have
your
you.
company.
Yeah. Well, thank you for letting me share Mabel, because she is an integral part of my life. She's who made me a mom, and I take any chance to share her with everyone.
And because she was here.
She was here.
Mabel was here. We hope that after today's conversation that you know that we see you. You are not the only one. It's not just you.
It's not just you. We welcome any comments, suggestions, questions at our email, midwifecrisispodcast@gmail.com, on our Twitter @midwifecrisispc, on our Facebook, the Midwife Crisis Podcast. Thank you so much. And until next time, remember, it's not just you. Thank you so much. And until next time, remember, it's not just you.